I want to share with you 4 things you didn't know about acid reflux. And then I'm going to give you 7 simple steps to reverse it. Hi, I'm Dr. Leila Ali. I'm a holistic pharmacist and author. My book is Off Balance, The American Way of Health, a pharmacist's perspective on why drugs don't work. And number 1, a lot of these medications are only safe for short-term use. Currently, the most commonly prescribed medications for acid reflux are a class of drugs known as H2 blockers. And these include Prilosec, Prevacid, Nexium, Acifex. These are only approved by the manufacturer for short-term use, 14 days or 8 weeks, but patients often take them for years. Number 2, the side effects. These medications are dangerous, especially with many patients taking them much longer than they're proven to be safe by the manufacturer. The side effects include diarrhea, low magnesium, increased risk of infection, increased risk of bone fracture, and vitamin B12 deficiency. Number 3, when you have symptoms, it's important to understand that that's your body working to create balance. Our bodies have a lot of components that need to be kept in balance for us to be alive. We have to be a certain temperature, have a certain pH level. We have to have so much glucose in the bloodstream. Our bodies are always working to keep these components in balance and survive. If you experience a symptom like acid reflux, it's important to understand that there's too much acid there for a reason, and we need to figure out what's causing our body to be off balance. And number 4, medications suppress your body's attempt to regain balance. If you're taking a medication to relieve a symptom without addressing the cause, then you're suppressing your body's attempt to create balance. An example would be temperature. When we're too hot, we sweat, and when we're too cold, we shiver. This is our body's attempt to regulate the temperature. What if you didn't like shivering and felt it was uncomfortable? The drug companies would then create a pill to help you stop shivering. But now it's no longer working to create that heat for your body. And this is what happens when you're suppressing acid in the stomach to feel more comfortable. The increased acid is often there to help with the digestive process. If you're suppressing acid in the stomach to feel more comfortable, then your body won't have the acid it needs to break down and digest the food. What's going to happen to your digestive tract when your food isn't being broken down like it should be? But you'll feel more comfortable. Hopefully you can see that taking acid reflux medications for the long term is dangerous. It suppresses the symptoms without addressing the cause. Now I'm going to give you 7 simple steps you can do to reverse it. Number 1, chew your food. Chew each bite at least 30 times because your stomach has the job to take anything you decide to eat and absorb the nutrients and then get rid of the waste. Eating slowly and chewing until the food is a liquid can take a lot of stress off of your digestive system, and sometimes this step alone is enough to stop acid reflux. Number 2, eat simple natural foods from the earth. Now our food is genetically modified, processed, artificially flavored, artificially colored, with added preservatives and chemicals, antibiotics, hormones, frozen, microwaved, with pesticides. The body has a hard time recognizing the resulting food-like substance and has to work hard to eliminate all the toxins. For best digestion, eat food that's natural and from the earth. Number 3, avoid foods that cause increased acid production. Some foods need acid to break them down, and these include alcohol, meats, carbonated beverages, corn oil, processed cheese, coffee, to name a few. Be aware which foods create excess acid and avoid when you need to. Number 4, digestive enzymes. These are like little Pac-Man in our digestive tract, and they help break down proteins, carbohydrates, and fats into smaller particles that can be absorbed. We naturally have enzymes, but as we get older, the body's production of enzymes decreases, but they can be replenished with these foods. You can also buy digestive enzymes at a health food store. Number 5, probiotics. Probiotics are the good bacteria found in a healthy digestive tract. These live organisms are part of the normal flora. If we take an antibiotic, we can wipe out a lot of the good bacteria. These can be replenished with certain foods such as yogurt, kefir, sauerkraut, kimchi, miso, or you can also buy this as a supplement at a health food store. Number 6, relax while eating. Many people eat at the computer or while driving, on the go, while they're stressed. When we're stressed, our body's fight or flight system kicks in. This causes adrenaline to flow, increased heart rate, deeper breathing, constricted blood vessels, sweating. These are responses that happen in a threatening or stressful situation. But this is not ideal for digestion. Digestion is optimal when we are relaxed. But today, people have constant low levels of stress all day long. So when it's time to eat, it's important to take time out, sit down, relax, have an uplifting conversation, or think only good thoughts of gratitude or appreciation. Turn off the news on TV and stay away from people who annoy you. Your digestive tract will thank you. And number 7, stop calling it a disease. When you experience acid reflux more than twice a week, now you have a condition called GERD, or gastroesophageal reflux disease. This is something that creates a bigger problem in our head. Now you have a diagnosis code with the insurance company, and now you have this thing where you need something outside of you to fix it. Drug companies do this to make simple conditions feel bigger so they can get more sales. So stop calling it a disease and realize that with a few shifts in your diet, lifestyle, and your thoughts, can make a big difference in your acid reflux, and most often, it's simply a matter of getting back in balance. So go ahead and take those steps to get off the acid reflux medications. It's easier than you may think. If you'd like to see more videos on how to get off medication, please subscribe to my channel. Thank you for watching.